Um, Hello, everybody, and welcome. My name is Daryl Gordon, and I'm Vice President of Marketing at MediKeeper. And thank you for joining us today. So some very, very quick housekeeping is we have a large attendance today, so we're not going to do live questions. You'll notice the chat functionality at the bottom of the screen in Zoom. You can submit questions to Dr. Amell at any stage, and we will address them during the session. We'll come back to them at the end. If we don't have enough time, we'll promise to follow up with you afterwards. We are scheduled to run 25 minutes today, and there will be a recorded copy of the session available afterwards. We're so proud of our monthly webinar sessions, all focusing around educational content. And today's topic is artificial intelligence and workplace wellness. What do I need to know? And to help us navigate this topic is the Chief Health and Strategy Officer at MediKeeper, Dr. Tyler Amell. Dr. Amell is an internationally recognized thought leader on the topic of workplace health and productivity. And I know that 25 minutes doesn't seem a lot of time here, Dr. Amell, so let's dive straight in. The stage is all yours.
Thank you very much, Daryl, and good morning, everyone. It's my pleasure to be here today. I'm very much looking forward to this discussion. This is a topic that's near and dear to my heart. And I'll start off by saying we're going to be speaking about artificial intelligence and machine learning and data analytics from the perspective of people like you or I. You know, we're not the computer scientists. We're not the people writing the code. At least we really don't want Daryl or I, or probably most of us on the phone, to be writing the codes out there. But we have to develop an appreciation and understanding to be able to speak from a sense of understanding about how to use these tools to better engage people in their health improvement journey. So that could be from a primary prevention perspective, a health promotion perspective, a workplace wellness component, or these sort of things. So I'll share some examples as to how I've interacted and used these tools over the years, and as we look to the near term future here as to how we can better leverage these tools through a better understanding, because there's a lot of misinformation and disinformation out there with regards to these tools and what they can truly do and how they can offer and improve things. So as Daryl mentioned, I'm the Chief Health and Strategy Officer at MediKeeper. I also wear a few other hats. I'm adjunct faculty and registrar at Pacific Coast University for Workplace Health Sciences. And I also sit on the executive board of the National Wellness Institute and the Work Wellness Institute. My contact information is at the bottom of the screen. Please feel free to reach out, follow me on LinkedIn. I'm very, very active at promoting evidence-informed practice when it comes to workplace health and productivity and all things related to the research around outcomes associated with various programming elements around getting people to improve their health. I also do a lot of speaking globally on workplace health and productivity. Here are some examples of some recent activities as well as some other ones. So I've started doing webinars dedicated to specific employers. So employers are reaching out and wanting a dedicated or curated talk on a specific topic for their people. And I'm more than happy to help support that. So I did one on sleep health back in May. I gave the keynote at the Workers' Compensation Institute annual conference, gave another employer-sponsored webinar on wellness biometric numbers. So basically helping people understand what those numbers mean and of course how to change them. And I also gave a plenary talk earlier this week on the 4-day work week at the IFABP Public Sector Conference. Now coming up, large conference in Seattle. It's another IFABP event, this one for the CEBS audience. This is the keynote on the future of healthcare and increased longevity. That'll be a very interesting one. After that, there's a conference in Ohio, the Ohio Employee Health and Wellness Conference. If you plan on attending, please don't hesitate to reach out. And this conversation will actually be an extension of today's. Of course, today's is very, very focused on and very, very short, meant to give you essentially what you need to know. We're actually hosting another webinar in September for MediKeeper, and this one is going to be on next generation biometrics. So we're bringing some of our lab partners to talk about new and exciting things in that space. And then at the end of September, I'll be speaking at the WellCOA Summit on evidence-informed practice around the science behind behavior change. So very much a full docket, very excited for a lot of these events. But let's get into the topic of artificial intelligence. Now, I gave it years ago, probably about a year and a half ago actually now, And I asked the audience, does your wellness programming use artificial intelligence to drive sustainable behavior change? It's a pretty innocuous question. And of course, we had advanced polling features. It was a cell phone text-based polling. And I gave people the following four options. So basically a tongue-in-cheek response. Well, what is artificial intelligence? That got a lot of laughter from the audience. Number two was I have no idea if my programming uses artificial intelligence. Number three was I think artificial intelligence plays a role in my programming. And four is artificial intelligence plays a major role in my programming. Now, almost everybody who responded to the poll, and this was a big audience, a few hundred folks, were in categories 1 and 2. There wasn't a lot of people who were responding by number 3, and even fewer responding to item 4. And that's not surprising because a lot of the technology vendors and support solutions out there don't necessarily have true artificial intelligence. A lot of them have algorithms, which we'll talk about in a few minutes, but the true application of artificial intelligence really isn't there. Now, the marketing material may say differently. I've helped some employers debunk some of those things in the past, wherein a vendor was claiming that they were using AI to drive some of the programming, when in fact they were basic algorithms in place there. And that's something that everybody needs to be aware of, is that there's a lot of smoke and mirrors when it comes to these sort of things. And arming yourself with good quality information and a position and understanding can really help you go a long way towards improving your own programming and making sure you select the right vendor partners when it comes to the technology and solutions to support your programming around workplace health. So let's answer some of the most fundamental questions and the important ones. So if we look at, this is a timeline, obviously 1950 to 2070. We're sitting in the 2020s right now. We've come a long way. Back in the 1940s, the computers were the size of your house. They're absolutely massive. There was a lot of mechanical working parts. They had a lot of computing power for the day, but that's inconsequential compared to what we have today. Like, this cell phone has exponentially more capabilities than what we had back in the 50s. And now, as time progressed, we got quite good at developing and shrinking technologies to the point that now we walk around with these in our pockets or in our purses. We've got a lot of computing power at our fingertips. And we can employ different types of solutions. So algorithms that I alluded to before, these are processes. So think a recipe. We want to look at this through our non-expert lens in this perspective. When you want to bake a cake for a special occasion or just for the heck of it, you know that there's a list of things that need to be done and a list of proportions and these sort of things. So algorithms are essentially that. We use algorithms in health risk assessment all the time as well. Given a set of behaviors or criteria or biometric values, we can categorize where people sit from a risk perspective, and based upon population norms, help predict where people could be, and then of course give them the information and the behavior change support to enact that behavior change so they can steer in a different direction. We do the same thing on the disease management side when it comes to interventions. So these algorithms are really there are processes, and there are a set of rules to be followed, either by calculations or other problem solving components done by people in the sense of making the cake, or by computers. So it works quite well in that sense. Computers are very, very good at those rote repetitive tasks and in executing on algorithms. Now, when it comes to artificial intelligence, here we're really talking about any technique which enables the computers to mimic human thinking behaviors, so cognitive abilities, to think like you do when you execute on a task. And this is extremely important because our brains are very, very complex. How we go about answering the question of 2 + 2 is 4 is a little bit different from how we would go about solving the question, maybe developing a wellness program. You've got to rely on your experience. You've got to rely on lots of inputs, on knowledge, on what you read, and bring all that together and then execute that task. Now, computers can do the algorithmic piece, but if we move into the realm of leveraging AI, where they are able to replicate and really mimic, and mimic is the key word, thinking along those lines to help them execute on that task. Now, machine learning is an AI technique that gives computers the ability to learn without being explicitly programmed to do so. So this is a little bit different. And there's also this concept of deep learning, which is coming to fruition now, which is a subset of machine learning, which make the computation of these multi-layer neural network capabilities. And these are, again, things that mimic processes in the brain and how our brains handle and process information and how we leverage that. Again, well beyond what we would need to do from a workplace health and productivity, but these types of components are quite elemental to giving us additional tools in our toolbox to help improve employee health and productivity. Now we've come a long way, as I mentioned before. We've had, gone from the days of computers being the size of houses to sitting in our pockets, and the technology has advanced to a significant degree. I put this slide up a couple of years ago at a keynote in Australia, and the audience burst out laughing because it's kind of a silly slide. We're looking at some pictures. It's a cross section between blueberry muffins and Chihuahua's faces. And the reason why this is important is because earlier machine learning and artificial intelligence in the broadest sense could not differentiate between the blueberry muffin and the Chihuahua's face. It was very, very difficult. You and I can do it almost instantly. We look at this, we can tell the muffin and we can tell the Chihuahua, but our brains are very, very advanced. Now we're at the stage that this is no longer a problem. The AI algorithms and machine learning elements that are being deployed from facial recognition and a whole host of other approaches are quite advanced, and they don't have a problem with differentiating between a Chihuahua and a muffin at this stage of the game. And in fact, we can actually access these types of solutions from a chat-based interaction that we'll talk about in a few minutes to really help give you a foundation that goes well beyond what we've seen historically in this space. Now, one of the reasons why this is important from my perspective is that I've been looking at this for over 10 years. Some colleagues and I published a paper in the Journal of Occupational Rehab, peer-reviewed publication back in 2013. Okay, so this isn't something that's been in the flash in the pan from my perspective. This is something that I've been watching and being a part of over the years to try to figure out how we can get better use of these tools within the workplace health environment. So this project was developing a computer-based decision support tool for selecting appropriate rehab interventions for injured workers. And this is a true cross section. There's myself, a few other occupational epidemiologists who specialize in population health and preventive medicine, and really sitting at the nexus between health data and technology, and how we use technology and data to get better outcomes when it comes to health. In this case, I'm the one, myself and one other person built the data set based on the claims experience of around 20,000 injured workers. And we used that to train the AI models. And we brought in some clinicians, and then we also brought in computer scientists, true experts in artificial intelligence. So this wasn't a vendor case where somebody was trying to substantiate something. This was actually quite in depth. And we published a whole series it related to this particular data set. Now, the important thing from an outcome perspective is that what we found is that the machine learning classification techniques appear to have resulted in better classification than the clinicians, which freaked the clinicians out because they were worried we were trying to replace them. But that wasn't the case at all. We still need somebody to do the work. Think of this as a wellness coaching intervention just as much as a return to work intervention. And so they were not necessarily very receptive to it, even though what we wanted to do, and probably what we should have done, was preface the interaction with the clinicians a lot more, saying, hey, listen, you're a great clinician. We want you to be an even better clinician by giving you better data to support your decisions around treatment executions. And so it was quite useful and beneficial, and it gave me a good solid foundation as to how these things actually work when we try to apply them to real world workplace health solutions. So some employers invite me in to sort of debunk what's going on from the vendors and how they're presenting these things. We use the RIPPER, so this is a repeated incremental pruning produce error reduction strategy with regards to the machine learning elements, and we tried 5 or 6 different ones in there to see which ones could produce the best results. And in fact, as I alluded to, we did get better results when using the algorithms and the machine learning component to get to that versus just the standalone clinical aspect of it. So more than happy to send you a copy of this paper or any of the other papers that resulted from this research. But it was quite foundational for me because it gave me the tools and understanding to help comprehend what's been happening as of late. Now, when it comes to data analytics, of course, myself being an epidemiologist, it's quite important to understand the data. Now, the data aren't the be all and end all, but there is a significant amount of work that needs to go in from an analytics perspective. Now, data analytics is very much a fancy word for statistics these days. It's looking at examining data sets and categories and different types of attributes to look for trends, to look for relationships, to look for causation, and then draw conclusions around that so that hopefully you can get to action. Now, I've been using this slide for a long time. Data aren't the end of the road, but they are foundational towards information, towards knowledge, towards insight, and then, of course, action. Action, if you don't actually proceed to action, well, what was the point of doing all this? Now, from an AI perspective, really what we're talking about is the knowledge and insight components and augmenting that and bringing it to a much higher degree. And of course, we still have the same issues as we've had before: validity, reliability, timeliness of data, completeness of data, whether or not it's meaningful or important. And there's big implications for action if your data are invalid or out of date or incomplete. And this is very important when it comes to training artificial intelligence, because if you use the wrong data set or use a biased data set, you're going to get biased results. And therefore, the foundation that you're trying to work on is going to be skewed, and it's not actually going to be that helpful in the grand scheme of things. Now, an example I gave not too long ago was to when somebody asked, oh, like, tell me about Google, tell me about how this works. And I'm like, okay, well, here, in this example, I've typed in workplace wellness programming. So in the essence of you interacting with Google or other search engines, essentially you're the intelligence, because you have to figure out what is relevant and what is important from a whole host of responses. So in this case, there's 278 million results. It took Google's servers, 0.5 seconds to figure it out. But if you look at the top three responses are as. So I don't know about yourself, but I've trained myself to never ever look at those. So I skip down to the thing that's not sponsored, and then that should be something that is related. But again, these are very advanced algorithms. There's page ranking. There's a lot of activities that take place on the back end to serve up the appropriate content containing these types of words and hopefully the meaning and intent. But you're not artificial, I'm not artificial, so we're not artificial intelligence, but it's our true intelligence that we need to use to decipher what this actually means to answer that question. So in essence, when we use artificial intelligence, we're trying to bring additional meaning to this to get to better information and a better foundational approach. Now, from our perspective, in terms of consumable AI and using AI, a lot of things changed back in November of 2022. You may be familiar with this concept of Chat GPT released by OpenAI. Now, it's a really means chat generative pre-trained transformer. This is a language-based chatbot essentially that helps answer questions by interacting with you, and you present a question to it, and then it'll think about it. It'll review what data it's consumed and what it's been trained on in the past, and serve up appropriate content that it thinks you're looking for. So well beyond just looking for the words, but actually answering the question. So this is my Chat GPT account. I've been using it since early December. I use it for a lot of things. I tested it out answering various questions around workplace health and medicine. I wanted to do a deep dive on a surgical process for chromioplasty for upper extremity conditions, and wellness programming, low back pain, metabolic syndrome. I played with this thing for a lot and asked it all these questions, and for the most part the answers are quite useful and helpful at a basic stage. Now, but I'm pretty well versed in these areas, so I could pick out little inconsistencies and potential problems with it that other people may not necessarily have that. So what I did is I type the exact same thing that we did earlier with regards to into Google, where I said I typed in workplace wellness programming. So this time I said, hey, listen, ChatGPT, build me a workplace wellness program. So what it had done is, and it goes through the iterative process, it'll go through, it'll and attempt to answer your question to the best of its ability using its AI power. So in this case, it gives you some information, and then it lists a whole lot of components. Now, one of the things that's quite interesting about ChatGPT is if you ask it again, you may get a slightly different response. And there's a few different reasons for that on the back end as to how this sort of comes to fruition. And so in this case, I ended up with 15 different components of a workplace wellness program where you could build upon. And that's really where the strength of using a tool like this, and of course, we don't have time to do a deep dive in any respects, but there are some very interesting things that can be done to basically do what I mentioned earlier, and that is to build a foundation and be a decision support tool or a tool in your toolbox to help you execute on the workplace well-being elements that you need. Now, from a strength perspective, this is really about augmenting your own knowledge. ChatGPT is never going to be able to build you a complete program from start to finish, at least not in the near term. And so you have to still use these elements and build upon them. Take that as a foundation. Perhaps use it for personalization, for health risk assessments, going beyond the algorithms. Navigations as people navigate the various capabilities and capacities of their wellness programs to better support them, to drive engagement, to enhance the workflow, to make things easier, to make things more intuitive, and really to help support the behavior change and the associated outcomes. So it's definitely things that can be countered from that perspective. Now, there are some big weaknesses here. The accuracy that I mentioned before is absolutely critical. You don't want to start basing your foundation on wrong assumptions or on incorrect information or misinformation or even disinformation. And so you have to think about that from that perspective. There's also bias. It's inherent in a lot of the algorithms and the artificial intelligence training material that exists out there. It's skewed in different directions. And it's quite difficult for us to have a truly unbiased interaction with these. There's ethical considerations, and there's, of course, privacy considerations. There's a lot of lawsuits launched against ChatGPT because of the training materials, the consumption of this material is proprietary. It could be somebody's textbook. It could be some of the research articles that are presented before. There's lots of different things at play here. And when you have these all-consuming web-based tools that are scraping and incorporating and thinking and mimicking our understanding and behavior, well, there's could be considerations there for compensation, for privacy, for ownership, and all these sort of things in place. And then, as I mentioned before, that accuracy of information, it's only as good as the training material consumed. And so if it's based upon inaccurate information or information that is constantly evolving as science is, well, then we have an awful lot of potential for problems there when it comes to applying this from a workplace health perspective, and particularly from a workplace wellness perspective. So, I realize we're at time. I wish we have the opportunity to go for a much deeper dive and provide more examples. But hopefully, this high level provided you with better understanding around what artificial intelligence is, what machine learning is, what deep learning is, what data analytics is, and how these can be used from a workplace health and productivity and wellness programming perspective. Now, one of the things that I think cannot be said again is this whole notion that if your wellness program does not have strong technology, it's going to be left behind. So things are advancing and things are moving. So it's better to understand and comprehend and at least figure out if this is a tool that you want in your toolbox at this stage to get to that point whereby we know we can leverage the power of these data and these technology elements to get to better outcomes and better serve people that we work with. So with that being said, I do thank you all for your attendance here today. I'm going to turn it over to Daryl, who's going to wrap things up.
Well, thank you, Dr. Amell. Sorry, it looks like you have access to my video camera there, so I can't turn it back on. But I wanted to thank everyone for joining us today. We did get some follow-up questions asking about getting copies of some of the research that you have, Dr. Amell, and I'm wondering how it might be made available to them.
Yeah, that's a really good question, Daryl. You can send me a note directly, reach out to me on LinkedIn, and that's probably the best way to do it from a grand scale. The other thing we could do, Daryl, is we could take some of those articles and put them up on the MediKeeper website. So there's a few different ways, but maybe you and I can chat about that. But in the meantime, if you want to tackle some of these things, just reach out to me on LinkedIn or send me an email, and I'd be happy to do that while we work on putting up some of these material online.
Thank you. Well, I know I have said this before, Dr. Amell, said that, oh, a half an hour isn't enough for us to tackle a topic, and clearly this was one of them. But I think you gave us some great educational content and some opportunity for us to go and learn more as we hang up from this call. We do have all of our webinars on our website, and as well as some great resources, and you do know where to reach us. I hope you will join us again next month for our next session. Thank you, and have a great day, everyone.
Thank you all.